Hello, I'm Dr. Arefa Cassoobhoy, a practicing internist and a medical editor for Medscape and WebMD. Welcome to our weekly brief on recent medical news and findings. First up, testosterone is an effective treatment for men with hypogonadism. A recent trial looked at 8 years of data on over 150 hypogonadal men. It found that those treated long-term with an injectable form of testosterone had improved urinary and sexual function. Not only did patients experience higher quality of life, but they also saw some striking changes in body composition, including reductions in waist circumference and BMI, as well as increases in lean muscle mass. In addition, those with type 2 diabetes saw improved blood sugar control. Investigators say that testosterone is an underused treatment for hypogonadal men. But as desirable as these outcomes may be, testosterone treatment shouldn't be offered to healthy men without hypogonadism. It's imperative for clinicians to confirm the diagnosis by looking at both symptoms and multiple morning serum testosterone levels. Next, chronic fatigue syndrome is in the news. It's now known as myalgic encephalomyelitis. Its vague, varied symptoms have often been dismissed as psychological, but now evidence suggests that its origins are biologic, possibly involving chronic immune activation. New studies attribute the illness to a complex neuroinflammatory process that affects the brain, autonomic nervous system, and energy metabolism. Also, it's important to note, chronic fatigue is not the universal hallmark symptom for this condition. Rather, almost all of these patients experience a phenomenon called post-exertional malaise. They react to physical or mental exertion by what's best described as crashing. Along with the fatigue, patients can experience cognitive difficulties, sleep disturbances, headache, muscle pain, and flu-like symptoms that can last several days for each episode. If you think your patient may have this, start by asking for a diary, documenting activities and symptoms for a week or two. And finally, it's no secret that losing weight is important for controlling diabetes. In a new study, almost 600 overweight patients with uncontrolled type 2 diabetes were randomized to an enhanced diabetes weight loss program by Weight Watchers. Or they got standard care with a visit to a dietitian along with some printed dietary information. Over the course of a year, the commercial group not only lost more weight, but achieved better glycemic control. 95% of these patients were taking diabetes meds at the beginning of the study, but 1 year later, 26% of the patients in the Weight Watchers group were able to reduce their meds, compared to 12% in the standard care group. The bottom line, patients with diabetes who need to lose weight might do better with a structured weight loss program like Weight Watchers. You'll find links to each of the stories we've included in today's news brief in the transcript listed below. For Medscape and WebMD, I'm Dr. Arefa Cassoobhoy.